Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the development of the liver. The liver or hepatic diverticulum develops at the middle of the third week of intrauterine life as an endodermal outgrowth from the terminal part of the foregut. The hepatic diverticulum continues to proliferate and penetrate the septum transversum. There is a mesodermal block, embryonic mesodermal block between the pericardial cavity and peritoneal cavity. You can say from pericardial cavity to the yolk sac. And the liver diverticulum continues to proliferate and penetrate the septum transversum, whereas its connection to the foregut narrows and forms the bile duct. A small outgrowth of the ventral bile duct forms the gallbladder and the cystic duct. The hepatic sinusoids are formed by the intermingling of the epithelial hepatic cord with the vitelline and umbilical veins. The epithelial liver cord derived from the endoderm of the foregut differentiate into hepatocyte and cholangiocyte. Hepatocyte is the parenchymal cell of the liver. Cholangiocyte will be the epithelium of the bile duct and the gallbladder, the luminal epithelium of the bile duct and gallbladder. Hepatocyte forms the parenchyma of the liver and cholangiocyte forms the lining epithelium of the biliary duct. The hemopoietic cells, these are derived from they are coming from the dorsal aorta. Connective tissue cells and the Kupffer cells are derived from the mesoderm of the septum transversum. All of them are mesodermal. Okay. The hepatic part proliferates rapidly, invades the entire septum transversum, and the developing liver bulges downward. At 10th week of development, the liver carries 10% of total body weight. Okay, so this is the hepatic diverticulum from the distal part of the foregut, and it will go towards the septum transversum. That is the way of development. The diverticulum is present in the ventral mesogastrium. Then it goes towards the septum transversum, the mesodermal, embryonic mesodermal tissue block from the pericardial cavity to the yolk sac. Okay. Now this is the hepatic diverticulum growing into the septum transversum. And we're seeing some sinusoids. These are coming from the segmentation of the hepatocyte to the umbilical vein and the vitelline vein. Okay, we got that. Then if you go here, we'll see now liver is a little bit enlarged here. Okay, this is the bile duct. Okay, this is the gallbladder. Then we have the cystic duct here. Okay, here is even larger. Okay, and from the liver to the duodenum and the stomach will get the lesser omentum. Okay, and from the liver to the anterior abdominal wall will get the falciform ligament. These are part of the ventral mesentery. Okay, this is the dorsal mesentery posteriorly to the stomach here. Okay, posterior to the duodenum and stomach, and this dorsal mesentery will contain the spleen and also eventually the pancreas. The dorsal bud as well as the entire pancreas will be retroperitoneal by the fusion of the dorsal mesentery to the posterior abdominal wall. Due to the rapid growth of the developing liver and the intestine, particularly small intestine, the intestine herniates through the umbilicus for a time being, because the abdominal cavity has not sufficient space for the developing liver and the intestine. So the intestine goes towards the umbilicus. The mesoderm between the foregut and the liver forms the lesser omentum. The mesoderm between the liver and the anterior abdominal wall forms the falciform ligament, which contains the obliterated left umbilical vein that forms in the adult ligamentum teres hepatis. Mesoderm on the surface of the developing liver differs into visceral peritoneum as well as the Gleason's capsule over the liver. Reflection of the peritoneum from the diaphragm to the liver forms the anterior and posterior layer of the coronary ligament, left and right triangular ligaments. Okay, so if you look at the image again, this is the foregut derivative stomach, the gallbladder and the bile duct as well as the liver. These are also developed from the terminal part of the foregut. Okay, this is the dorsal mesogastrium containing the spleen. Okay, we have the dorsal pancreatic duct, this is the ventral pancreatic duct, this is the gallbladder, this is the ventral and dorsal pancreatic duct, this is the gallbladder, developing cystic duct and the common bile duct developing. Here we are seeing the liver develop in the septum transversum. This part will give rise to the lesser omentum. Okay, lesser omentum, and this will form the falciform ligament. If you look at here, gastrosplenic ligament, spleen are in the dorsal mesogastrium. Ventral mesogastrium will get the hepatogastric ligament, and in front of the liver and the abdomen we have the falciform ligament. Here, if you look here, spleen, the pancreas, it is going to be retroperitoneal, and the pancreas, this is the hepatogastric ligament here. This is the falciform ligament from the liver to the anterior abdominal wall. Okay, it contains the ligamentum teres hepatis. Okay, so here again the pancreas is now retroperitoneal. The spleen, it is also in the dorsal mesogastrium. It is going towards the left. Okay, this is the liver. Okay, the rapid growth of the liver gradually subsides during the last 2 months of the fetus. 9th month, 8th month. The hepatopoietic function also decreases significantly. The protruded intestine in the umbilicus return back to the abdominal cavity at birth, usually. At birth, the liver is only 5% of the total body weight. To remember some milestone, by 12th week, the bile is produced by the hepatocyte, gallbladder and cystic duct are formed, and the bile can enter the second part of the duodenum in concert with that of the pancreatic duct at the hepatopancreatic ampulla. Due to the positional changes of the duodenum, the common bile duct passes behind the duodenum. Okay, genetic regulation of the liver development. Multiple gene work here. Entire foregut endoderm has the capacity to develop hepatic bud. But hepatic bud is formed from the terminal part of the foregut because we have some inhibiting factor produced by surrounding tissue including ectoderm, non-cardiac mesoderm and particularly notochord. These inhibitory factors are inhibited or blocked by the FGF2, fibroblast growth factor 2, derived from the cardiac mesoderm and endodermal cells near the foregut. FGF2 guides the hepatic and the gallbladder development in concert with bone morphogenic protein BMP derived from the septum transversum. The differentiation of endoderm to hepatocyte and cholangiocyte is partially regulated by the HNTF3, hepatocyte nucleotide transference factor 3, and HNTF4, hepatocyte nucleotide transfer factor 4. Okay, this will help in partial differentiation along with all of these to be differentiated into hepatocyte and cholangiocyte. Okay, liver and gallbladder anomaly. There may be multiple anomaly we might have. Usually the liver has no anomaly. Accessory hepatic duct is very common. Sometimes it may open directly into the gallbladder. Okay, it is present in the fossa for the gallbladder and it opens into the gallbladder directly. Duplication of the gallbladder is not uncommon. Duplication of gallbladder. Extra hepatic biliary atresia. So this may go through atresia. Extra hepatic biliary atresia. There may be intrahepatic biliary atresia and they may need liver transplantation and surgery. Otherwise, life will be in jeopardy. Floating gallbladder like this. It is the gallbladder is floated by a mesentery, even it may be larger than this. So the gallbladder may be twisted. Anomalies of cystic duct. Cystic duct may be very small, may be long. Okay. And the gallbladder has some anomaly like Phrygian cape. Phrygian means the people live in Phrygia province of present day Turkey. Okay, they are cap-like appearance that may happen. Okay, hourglass gallbladder is also possible but very rare. Okay, there may be neck here, abnormal leg of the gallbladder. Okay, so these all are anomalies. So this is very important for the surgeon who do cholecystectomy. They should know the anatomy and possible anomalies of the gallbladder. So problem of the gallbladder, anomalies of the gallbladder is more than that of the liver itself. And that's all about the development of the liver. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.